Access to safely managed sanitation is a human right, such as the right to education or health. Today in West Africa, 75% of the population still do not have access to improved sanitation services. In Senegal, 60% of urban population use on-site sanitation facilities. This results in a significant production of fecal sludge that is most of the time dumped without proper treatment into nature. Fecal sludge is a combination of human feces and wastewater, which accumulates at the bottom of latrine pits and septic tanks. To durably improve living conditions in our cities, we must take into account the whole fecal sludge management value chain, from household management, collection, transportation, dumping, treatment, all the way to recovery.
L'objectif du PSMV, c'est de voir comment nous pouvions améliorer l'assainissement autonome. Donc c'était un projet pilote et les principales réalisations, ça permet de tirer les leçons pour montrer d'abord que nous avons une chaîne de valeur qui fonctionne correctement avec le PSMV, mais surtout qu'on peut développer l'assainissement autonome. Encore une fois, c'était un programme pilote.
The private sector has an important role to play in the value chain set up by ONAS. Indeed, the collected sludge is transported from households to treatment plants where it's treated. The Dakar region alone has 4 fecal sludge treatment plants, all delegated to the private sector.
La vision actuelle de l'ONAS dans tout le secteur de l'assainissement autonome, c'est de donner la même qualité de service pour l'assainissement collectif que nous avons dans les villes que pour l'assainissement autonome qu'on retrouve essentiellement dans les centres périurbains. Cette vision pourrait permettre d'atteindre l'objectif 6 en fournissant une qualité de service et surtout dans des zones où il n'y avait pas du tout d'assainissement, il n'y avait pas de suivi. Donc justement, c'est ce passage à l'échelle qui va démarrer à partir du mois de juin 2018 qui permettrait d'atteindre ça avec une forte implication d'autres partenaires.
Convinced of the sector financial viability, Senegal introduced a series of processes to recover on-site sanitation subproducts and transform fecal sludge into energy, water, and fertilizer.
Le premier objectif, c'est de mettre toutes les parties prenantes du projet autour d'une même vision, une vision commune, qu'on a appelée la délégation de service public de l'assainissement autonome, la DS2A. Le deuxième objectif, c'est d'impliquer fortement le secteur privé dans la matérialisation de cette vision.
In 2018, after 7 years of implementation, ONAS is now scaling up its pilot project to ensure greater reach into the country's urban centers. Through a greater involvement of the private sector, ONAS aims to move closer to its 2030 Sustainable Development Goals and ensure access to adequate and equitable sanitation and hygiene for all, and end open defecation, paying special attention to the needs of women and girls and those in vulnerable situations as stated in the Target 6.2.
Bangladesh, known to the world as the Queen of Beauty. This beautiful flag bears the story of limitless sacrifices.
এবারে সংগ্রাম আমাদের মুক্তির সংগ্রাম এবারে সংগ্রাম স্বাধীনতার সংগ্রাম
Millions of deaths, unimaginable sufferings and sacrifices made the dream come true. The war of 1971 made a country and a nation who promised never to bow down. Since its independence, Bangladesh has flourished herself and has made a remarkable progress in education, women empowerment, infrastructure, health and hygiene, human rights, democracy, and so many ways aligned with the world. Bangladesh has achieved remarkably in the Millennium Development Goals in terms of poverty reduction, attaining gender parity at primary and secondary education, under 5 mortality rate reduction, reducing the prevalence of underweight children, lowering maternal mortality ratio, improving immunization coverage, water sanitation coverage, and reducing the incidence of communicable diseases.
We all know that Bangladesh has achieved historic progress in achieving almost zero open defecation and made good progress towards the target of the Millennium Development Goals. Because of such improvements, the casualty from etheric disease has fallen rapidly. We know in Agenda 2030, the Sustainable Development Goal 6 aims to tackle challenges related to drinking water, sanitation and hygiene for the population as well as to water-related ecosystems. We have to focus on equality, sustainable water resource and sanitation, and with a view to having solid progress in many other areas across the SDGs, including health, education, and poverty reduction.
And it became one of the promising countries towards attaining sustainable development goals to end poverty, protect the planet, reduce gender gap, mitigating climate and disaster risk, ensuring safe water and sanitation for all, and confirming that all people enjoy peace and prosperity by 2030. Bangladesh is already showing its commitment towards SDG 6, water and sanitation for all. Bangladesh has achieved an outstanding growth. Already, the country has attained almost zero open defecation, which is a remarkable success of sanitation. In 2019, 84.6% of household members were using improved sanitation facilities and 74.8% of households reported practicing a hand-washing facility with soap and water, and the number is rising even among the poorest of the poor. Bangladesh is one of the members of the high-level panel on water convened by the UN and the World Bank.
We need to take action for proper management of the freshwater ecosystems and access to the safely managed sanitation. Those are essential to the human health, environmental sustainability, and the economic prosperity. We need to sustain the success we have achieved in the safe water and sanitation sector and the role of all concerned in the tackling and existing challenges and turn our acquired experience into the social movement.
Despite these accomplishments, it would be a big challenge to achieve SDG 6 if we can't manage the fecal sludge with a coordinated approach. To achieve SDG 6, the government of Bangladesh is bringing all actors in a row. Coordination development partners and incorporation of FSM in different sanitation and development projects are reflecting the government's commitment towards achieving the SDG Target 6.2. Utilization of modern technology for FSM, capacity building of stakeholders, and financing for FSM business are some of the key actions but the government is working with partners. Still, there is a long way for this journey. Overcoming the financial and technological challenges, engaging and influencing decision makers at different stages are some of the challenges that need to be addressed rigorously. And each and everyone who has a stake in the sector should work together to attain the goals. To overcome these challenges, a sectoral commitment with the GO-NGO collaboration named FSM Network has been established. The FSM Network is a platform that is working to make this impossible to I am possible. To plan and implement a proper action to achieve SDGs, it's demand for guidance on how best to establish supportive, enabling environment for sanitation through strong policies, plans and legal frameworks. As a result of the coordinated effort between the government and FSM actors, the institutional and regulatory framework IRF has been adopted in 2017 with the central notion of ensuring safe sanitation service in Bangladesh aligned with SDG Target 6.2. The government has also adopted the principle of mechanical emptying of pits and toilets nationally, considering health and safety of sanitation workers. The National Action Plan NAP for implementing IRF FSM in the municipalities has also been approved and adopted by the government for FSM in 2020. To ensure effective FSM following a sustainable approach, a CWIS FSM support cell has been established in DPHE under the Local Government Division. The cell is supported by Bill and Melinda Gates Foundation.
We all know that the SDG target is to achieve the safely managed sanitation countrywide. There are challenges of identifying appropriate indicators of safely managed sanitation in Bangladesh. Also, it is important for the country to improve containment as well as entire sanitation chain, not only having toilets. In parallel, solid waste management needs to improve for overall environmental sanitation. CWIS FSM support cell will work closely with relevant sector actors on this. There are more than 100 municipalities where fecal sludge treatment plant will be constructed within 2 to 3 years and under different projects of Department of Public Health, Engineering and many more.
We are triggering to develop the CWIS ecosystem in Bangladesh under the leadership of the government so that we can work collaboratively with the government, NGOs, INGOs, sector partners, private sectors all together and to achieve the equitable sanitation service for all. And CWIS FSM support cell is now providing the technical support to this government so that we shall have the journey together. Our primary task is number 1, to have the coordination with all the sector partners so that we will have our journey together of this sanitation and safely managed sanitation. Number 2 is that we need to develop the capacity of the sector, and for which CWIS FSM support cell together with IT and GUET is working to develop the capacity of all the Poroshobhas of the country gradually. Number 3 is the technical solutions is very much important. What treatment technologies are required to reach the SDG 6.2 target? There are a number of innovative technologies as like omniprocessor, biodigester, reinvented toilet, and we need to create the market for these technologies to reach the SDG 6.2. And finally, the dashboard for the data monitoring system is very much important because there is a lack of data of this SDG 6.2 right at this moment in Bangladesh, and we are developing the national dashboard for monitoring SDG 6.2 so that we can get the data of the Poroshobhas or municipalities in the country. And the last one is very acute as we are doing the advocacy with the International Finance Institute, where we are supporting the government for further investment in sanitation journey, so that we will have our journey together in the ecosystem.
Developing CWIS ecosystem is another major achievement of the FSM sector to ensure a sustainable solution of sanitation for all. During the COVID-19 pandemic, the importance of public health has been realized more than ever. The safe management of fecal sludge is one of the key elements to keep the country healthy and safe. The government is prioritizing the safety and health of the Bangladeshi people by ensuring safe sanitation for all.
Bangladesh is a growing country, and beside this pandemic situation, we are also facing all these challenges very seriously, and we hope sooner or later antidote will come, and the world will get chance to escape from this case of pandemic, and same in Bangladesh. But one of the big advantages in Bangladesh, under the leadership of our Honorable Prime Minister, is unified. All the peoples of Bangladesh are very much optimistic to work under the leadership of Honorable Prime Minister. So this is why, whatever the effect it had about the pandemic, then country after completion, after the end of this pandemic, then Bangladesh could rescue this whatever the situation facing nowadays. It will be rescued very successfully. So I believe that the development partners, those who are working with us, and we all together work for these kinds of a solid waste and fecal sludge management, and as well as all other issue, whatever is required, they will be with us. In Bangladesh, I think in South Asia could be exemplary country about many issues, including the city inclusive sanitation.
Our promise is to work together collaboratively to achieve safely managed sanitation service nationally.
The Lusaka Sanitation Program actually is a program that is covering developmental, infrastructure development and institutional strengthening for all stakeholders in Lusaka City, and covers aspects of storage networks, covers also pumping stations, storage pumping stations, wastewater treatment plants, but also covers sanitation facilities for on-site sanitation or for areas where we're not able to provide storage services. We also have what we're calling fecal sludge management as an innovation that the program came up with to be able to manage the waste that is generated in Lusaka City.
On-site sanitation is a new theme that has come into the regulation arena, because in the past we've been focusing on sewage sanitation, and even with sewage sanitation there was not so much of effort with regards to regulation. But now we are moving into the area of on-site sanitation, because we realize that most of the urban poor particularly are served by non-sewage facilities, so we need to really see how we enhance regulation in that area.
We've come to a realization that we cannot just provide the conventional storage services. So in view of that, we've entered into a new business line where we're providing the on-site sanitation services. As a utility, Our customer comprises of people in the urban and the peri-urban areas. And the challenge we have is that 70% of this population is in the peri-urban areas. Now, these peri-urban areas, historically, these areas were unplanned, and the conventional sewerage services were not available in these areas. In order to provide sanitation services, we have come up with a master plan that goes from 2011 to 2035.
We are actually the pioneers of fecal sludge management unit. This came into being when we discovered a problem that the sources of water supply for the residents of Kanyama were at risk of being contaminated because of the number of pit latrines that we have in Kanyama. And then we discovered at the same time that there was no formal kind of service being given to the residents of Kanyama. As a result, we developed this system with the help of the community and also with the help of Lusaka Water and Storage Company to develop a fecal sludge management system.
In our community, Kanyama, we find that people normally throw rubbish things in the pit latrines. So it's very difficult to empty it compared to LSP toilet.
In order for us to safely manage the waste, we have partnered with the private sector. There are 6 private sector employers who we are working with in the core communities, and the target is to empty 12,000 household toilets, which is going to benefit over 230,000 people. So we're providing capacity through the Lusaka Sanitation Project in terms of equipment to the private operators. So far, we've provided them with some light trucks, which will enable them transport the waste.
So when they request for the services, we send our people to go and do an assessment on that pit. Then after doing an assessment, that's when now we advise the customers on how many barrels they can go for in order for the pit to be emptied. So once they empty the pit, they will take the sludge using our vans and to the transport to the treatment plant, where the sludge is treated. Once it is treated, it is converted into manure, and that manure is sold to different customers also.
In the end, the objective is that we end up improving the public sanitation and public health for the city of Lusaka, and ultimately that this then gets rolled out as a model around the country and hopefully also around the region.
Due to rapid population growth and urbanization, the proper management of solid waste, wastewater, and fecal sludge is becoming more challenging. According to Multiple Indicator Cluster Survey 2019, 89.5% of Nepal's population rely on non-sewered or on-site sanitation system. But due to lack of relevant policies and guidelines, or the lack of their effective implementation, planning, management, or priority, the situation of these non-sewered sanitation system and fecal sludge management is more vulnerable and inconsistent. The collected fecal sludge are disposed haphazardly into the rivers, forest, or open space without any treatment. Such malpractices have polluted water bodies, which in turn have imposed negative consequences on our environment and public health. However, with Nepal declared as open defecation-free nation, many commendable initiatives have been undertaken in sector of urban sanitation. In this context, with an aim to improve the municipal environment and sanitation situation, Mahalakshmi Municipality, Lalitpur is implementing pilot implementation of FSM standard in Nepal, Mahalakshmi Lalitpur as pilot municipality project in the municipality. Located in the southwestern part of the valley, Mahalakshmi municipality comprises of former village development committees such as Imadol, Siddipur, Lubu, Tikathali and Lamatar.
ODF डिक्लेयर गर्दाखेरि मैले त्यसबाट के लेसन लर्न भयो भने हाम्रो नगरपालिका भित्र भएका सेफ्टी ट्याङ्कहरुबाट चाहिँ मानव मलमूत्र चाहिँ चुहिएर हाम्रो पानीका मुहानहरु इनार कुवादेखि लिएर नेचुरल वाटर बडीजहरु चाहिँ कन्टामिनेट भइरहेको छ। यो कन्टामिनेसनको कारणले गर्दाखेरि चाहिँ हाम्रो एउटा चाहिँ वातावरण प्रदूषित भइरहेको छ भने दोस्रो मानव स्वास्थ्यमा चाहिँ प्रत्यक्ष असर परिरहेको छ।
In order to address these issues and solve the problems, the project of pilot implementation of the ISO 24521 guidelines for the management of basic on-site domestic wastewater services is being implemented in Mahalakshmi municipality. The project, which is supported by Bill and Melinda Gates Foundation under grant assistance and conducted in collaboration with Mahalakshmi Municipality, Kathmandu Valley Water Supply Management Board, and Environment and Public Health Organization INFO, is the first of its kind in Nepal and globally.
इन्फो काम चाहिँ टेक्निकली उनीहरूलाई सपोर्ट गर्ने हो। हामी सबैजना मिलेर सहकार्य गरेर यस्तो खालको बनाऊ जुन चाहिँ के हुन्छ भने भोलि पर्सि गएर हेर्दाखेरि एकदम स्ट्यान्डर्डाइजेसन भयो, अर्को चाहिँ यसलाई अर्को ठाउँमा पनि लग्न सकिन्छ।
Under the project, a three-party MOU was signed between Mahalakshmi Municipality, Kathmandu Valley Water Supply Management Board and INFO, with an aim to inform all the relevant stakeholders about the project and its activities, and also to collect suggestions and feedbacks. A kick-off meeting was organized and then the project activities were initiated. A technical assistance team was formed to provide necessary technical support for effective implementation of the project, and plans were formulated through various discussions and meetings. On the basis of sanitation situation assessment of the municipality, the municipal citywide inclusive sanitation plan has been prepared. One of the key achievements of the project is the national adoption of ISO 24521 guidelines by Nepal Bureau of Standards and Meteorology.
नेपालको कन्टेक्स्टमा नेपाल ब्युरो अफ स्ट्यान्डर्ड्स एन्ड मेट्रोलोजी जुन नेशनल स्ट्यान्डर्ड बडी हो उसले चाहिँ स्ट्यान्डर्ड्स बनाउँछ। अब यो केसमा एडप्सनको लागि प्रपोजल गर्नु पर्यो, त्यसमा इन्फोले प्रपोज गर्यो। अब एप्रुभल नेपालको केसमा कसरी हुन्छ भन्दाखेरि एउटा काउन्सिल छ, त्यसले एप्रुभ गरेपछि अनि त्यो स्ट्यान्डर्ड बन्यो।
To strengthen organizational, technical and managerial capacity of Mahalakshmi Municipality and accelerate its sanitation activities, a sanitation cell has been established under Environment Management Division of the municipality.
जसरी हरेक स्थानीय तहमा विकासका अन्य भौतिक पूर्वाधारहरूलाई जति महत्त्व दिइन्छ तर स्यानिटेसन सम्बन्धी विषय चाहिँ खासै महत्त्व दिइरहेको छैन, साथै यसको एक्टिभिटीहरू चाहिँ त्यति महत्त्वको रूपमा लिइरहेको छैन। यो एक्टिभिटीहरूलाई चाहिँ एकदम गति दियोस् भन्नेको उद्देश्यले चाहिँ मालक्षी नगरपालिकामा छुट्टै स्यानिटेसन सेल स्थापना भएको हो।
In order to reduce health hazards and environmental pollution through safely managed sanitation services, Mahalakshmi Municipality has approved and published Fecal Sludge Management Bylaws 2076. This is the first time in Nepal that a specific bylaws on fecal sludge management has been enacted by the municipality.
FSM bylaws-मै हामीले के कुरा उल्लेख गरेका छौं भने स्ट्रिक्टली नयाँ घर बन्दाखेरिको अवस्थामा हाम्रो चाहिँ सीड सेफ्टी ट्याङ्की हुनुपर्छ। सीड सेफ्टी ट्याङ्की छैन निर्माण सम्पन्न घर नदिने कुरा हाम्रो बाइलजमै हामीले राखेका छौं र त्यसपछि त्यसले रेगुलर डिस्लजिङ गर्ने तर्फ पनि हाम्रो बाइलजमा उल्लेख गरेको छ।
Like in other municipalities, lack of awareness in general public regarding the importance of sealed septic tank has become one of the major challenge for the municipality.
उचित प्रकारको सेफ्टी ट्याङ्की हुनको लागि तीनटा कुरा हुनुपर्छ। एउटा भनेको वाटर सिल हुनुपर्छ, दोस्रो भनेको सेफ्टी ट्याङ्की भित्र जम्मा हुने फोहोर पानीको हाइट हुन्छ त्यो भनेको 1.2 मिटर भन्छौं, त्यो भन्दा चाहिँ कम हुनु हुँदैन। र तेस्रो भनेको सेफ्टी ट्याङ्की भनेको फोहोर पानी जम्मा गर्ने हो तर सधैँको लागि जम्मा गर्न सक्दैन। त्यो निस्केको पानीलाई चाहिँ कहीँ विसर्जन गर्ने हो सुरक्षित, त्यसको लागि सोकपिटको आवश्यकता हुन्छ, त्यो सोकपिट हुनुपर्छ। यदि यो तीनटा कुरा नहुने हो भने त्यो प्रपर सेफ्टी ट्याङ्की हुँदैन। 55% भन्दा बढीले चाहिँ मेरो घरमा सेफ्टी ट्याङ्की छ भन्यो, त्यो मध्येको चाहिँ जम्मा 11% मात्रै चाहिँ सेफ्टी ट्याङ्की रहेछ, बाँकीमा चाहिँ सेफ्टी ट्याङ्की नै होइन रहेछ। एक खालको खाल्टो रहेछ, त्यसले के बुझाइयो भने दुईटा कुरा भयो। एउटा जनताको तहमा सेफ्टी ट्याङ्की भनेकै बुझाइ चाहिँ गलत रहेछ। त्यसले गर्दाखेरि हामीले जनचेतनामूलक क्रियाकलापहरू गर्दैछौँ। जस्तै अब भिडियो डकुमेन्टहरू बनाएर कुनै पर्चा पम्पलेटहरू निकालेर उहाँहरूलाई वितरण गर्ने र जानकारी दिने कामहरू हामीले गरिरहेका छौँ। एक दोस्रो भनेको क्षमता अभिवृद्धि पनि गर्नुपर्छ भनेर हामीले नगरपालिकाका सम्पूर्ण वडाका प्राविधिक साथीहरूलाई चाहिँ राखेर उचित प्रकारको सेफ्टी ट्याङ्कीको बारेमा जानकारी दिने र डिजाइन कसरी गर्न सकिन्छ भने तालिमहरू पनि प्रदान गऱ्यौँ होइन। अब त्यो तालिम प्रदान गर्ने सँगसँगै त्यो प्रपर कन्टेनमेन्टको चाहिँ टेक्निकल डिजाइन म्यानुअल भनेर म्यानुअल नै निकाल्यौँ। तेस्रो काम हामीले अब सस्तो खालको प्रविधि के हुन्छ भन्ने क्रममा चाहिँ अहिले रेडी टु इन्स्टल सेफ्टी ट्याङ्क प्लास्टिकको सेफ्टी ट्याङ्कलाई चाहिँ इन्डियादेखि साँचो ल्याएर नेपालमै अहिले सेफ्टी ट्याङ्क चाहिँ उत्पादन हुन्छ।
Various information, education and communication materials related to sanitation and fecal sludge management have been published and disseminated through various media to increase public awareness on fecal sludge management.
जुन नगरपालिकाहरू इस्टाब्लिस भए ती नगरपालिकाको हाम्रो चाहिँ वास्तविकता हेर्ने हो भने यो चाहिँ रुरल र अर्बनको मिक्स कन्टेक्स्टमा छ। यसलाई नै ध्यानमा राखेर चाहिँ हामीले कुन स्थानमा हामी सिवर नेटवर्कमा जाने र कुन स्थानमा चाहिँ हामी नन सिवरतिर जाने भनेर हामीले एउटा प्लान बनायौँ।
एफएसएम स्ट्यान्डर्ड्सले त सबैलाई इन्फ्लुएन्स गर्छ नि। इफ यु आर मेकिङ अ टोइलेट एट यर हाउस होइन, त्यो टोइलेट चाहिँ सेफ हुनु पऱ्यो नि पहिला कुरा त। त्यहाँबाट निस्केको पानी चाहिँ जथाभावी खोलामा जानु भएन। स्टेक होल्डर भनेको सेनिटेसनमा इन्भेस्ट गर्ने हाम्रो घरधनीहरू, त्यो सेफ्टी ट्याङ्क क्लिनिङ गर्ने, सेफ्टी ट्याङ्क पहिलेसम्म सेफ्टी ट्याङ्क बनाउने मान्छेहरू, त्यसलाई अप्रुभ गर्ने मान्छेहरू लाइक गभर्मेन्ट्स, लोकल गभर्मेन्ट्स, साथसाथै त्यसमा काम गर्ने ट्रान्सपोर्टर्सहरू छ। त्यो ट्रान्सपोर्टरमा काम गर्ने चाहिँ मान्छेहरू होइन, त्यसको साथसाथमा ट्रिटमेन्ट प्लान्टमा काम गर्ने मान्छेहरू सबैले छुन्छ नि।
ISO 24521 को जुन FSMको प्रोजेक्ट छ त्यो प्रोजेक्ट अन्तर्गत चाहिँ यो वातावरण सुरक्षित गर्नको लागि पनि यो आवश्यक रहेछ। अर्को हाम्रो मानव स्वास्थ्यलाई नै यो चाहिँ पानीजन्य रोगबाट बच्नको लागि पनि यो चिजहरू चाहिँ अत्यन्त आवश्यक रहेछ भन्ने कुराहरू चाहिँ मानिसहरूले बुझिरहनु भएको छ। यो सिकाउने क्रममा चाहिँ राम्रो किसिमको सफलता चाहिँ यो प्रोजेक्ट मार्फत हामीले प्राप्त गरेका छौँ र यसलाई अझै बढी प्रभावकारी बनाएर लानको लागि अझै प्रचार गर्न चाहिँ अझै जरुरी छ।
The issues of fecal sludge management are still least prioritized at national, provincial and local levels. As a result, in absence of necessary policies or their effective enforcement, the issues further pose a great challenge specifically for women, disadvantaged groups and the informal settlements. In order to address all these problems and achieve Sustainable Development Goal 6.2 targets, it is imperative to replicate the project achievements and lessons learned in other municipalities across the nation. Yet, the achievements of Mahalakshmi municipality are still not enough, and the journey of the municipality continues to relentlessly carry out further activities on citywide inclusive sanitation. Furthermore, Mahalakshmi municipality firmly believes that if the sanitation is prioritized and inclusive sanitation facilities and systems are developed and effectively implemented across the entire sanitation value chain, radical change in every municipality of the nation is possible.